Hello, another talk today, and this is a talk for the ones of you that have fear on missing out on something by going into internal medicine or family medicine. And I just want to tell you, you may not be missing on much. You actually may be choosing having a life versus working super hard. So let's start by saying uh, if you have to know your limitations, okay, and this comes from the bottom of my heart for you guys not to harm your chances when applying. I hear a lot of these hey, what if I apply to 100 internal medicine programs but I also apply to 10 derm programs, um, just to try, because it was my dream all my life, and I always wanted to be a derm. In my country was going to do a derm specialty. So should you do it? The answer is no, no. So if you know your limitations, if you need a green card, if you don't have publications, if you don't have research history, if you have low scores, you shouldn't apply to competitive specialties. And um, even if you do have all those, your chances to match into those highly um, competitive specialties is very low. So, um, especially if you don't have, what's needed, the credentials that are needed, then don't harm your chances of matching into a primary care specialty like family practice, pediatrics, and internal medicine. And so, what I'm going to tell you today is what can you do if you have this fear of missing out on life on something that you liked before. So, I'm very happy. For me, I'm very happy that I am a primary care doctor. Why? Because I'm an entrepreneurial person um, since I was very young. So I was always looking for side gigs, always. And um, surgeons, yeah, they make a lot of money. They make probably twice as much as I make, but they work twice as much as I work, unless they are very savvy and they find side gigs that are able to provide that extra income without that much work. So, a surgeon, um, most of the times, a surgeon has to find or start his own private practice to be able to build on his own and to be able to do surgeries on his own and to bill directly to make that money. And it's volume. They have to do more and more surgeries. And to do more and more surgeries, guess what has to happen? You have to be on call in a hospital. And usually calls are at night, the ones that pay. So at nighttime, if you think you're sleeping and you just want to be off today, but they call you for a patient that is your patient in your office, they're not going to call the on-call person. They're going to call you because you are his doctor, so you should take care of what is going on with him. And so surgeons have a very limited amount of freedom until they really set up the way they want to work. But in the beginning, when they want to get their names known in the community that they work, they have to put on a lot of hours, and also to get referrals from other doctors. So that's the way to make money. If you're thinking about the way of making money, is working hard, and you have to be careful when you try to work hard, because you have to also put the same effort on protect yourself by documenting properly, being up to date with current management and those things. So there are side gigs for physicians, and in as a primary care doctor, not talking about specialties, subspecialties. I'm not talking about GI, being a GI or cardiologist, or being uh, I don't know, any subspecialty on internal medicine or family practice. I'm talking about what can you immediately do after graduating as a family practice or internal medicine um, doctor. So you can work on aesthetics. Aesthetics means that you can maybe you can open a little office, um, and market your office as a place where you do Botox, where you do peelings, where you do liposculpture, and any skin procedures, biopsies, those things that you learn to do during residency. You learn you have rotations with a derm doctor, and you can learn those things. You can get an extra rotation on derm to just to keep learning about that. Every year you can just have an elective rotation on derm just to keep learning more. So by the time you get out, you start your little aesthetics office, and you start doing that. And with time, as it builds and builds and builds more patients, you will get there. You get there. You have enough. I have a lot of friends that do this on the side as side of working as hospitalists. They have their little office where they do Botox injections, where they do peelings, and they're happy. They have a good added income to what they normally earn, but their main income comes from being a hospitalist. Some of them get so big that they stop working as hospitalists and they just do this without doing a dermatology rotation or a dermatology specialty. You can do a dermatology fellowship for family practice and internal medicine. There are some in the country. I believe there are 3 or 4. So there may be more. I don't know. I never really looked into that. I met a couple of those doctors that are family practice and did a derm fellowship. It was 1 year, and they work as derms in the community, but they don't get paid as derms. They get paid a little higher than family practice, but they could start their practice. They have the knowledge to do different things because they have had this fellowship that backs them up in paper. Okay, that's one. You can do, let's say you like surgery, right? Like you like surgery and you can live life without doing a surgery. There are some things that you can do as a primary care physician. For example, you can be an assistant to surgeries. When I graduated in family practice, one of the things that the doctors that knew me around here that were surgeons were saying, hey, would you like to come and assist me to do my surgeries? And I already signed up for hospitals, but I wish I would have explored that. I know of 2 family physician doctors at my hospitals that are assistants to surgeons, and that's all what they do. They assist and assist and assist. And I get to think about that. It comes with a lot of benefits. First, you are not the main surgeon, so the whole responsibility on taking care of this patient doesn't fall on you. You don't have to do follow up. You don't have to be on call for that patient. It's the main surgeon that wants to deal with all that. You just get paid for assisting, and that's it. I know these 2 family practice doctors that do only that, and they're happy. And okay, next one is you can be in an OB fellowship, and you can do C-sections. The OB fellowship is, I believe, 1 year. You can do C-sections after that. Not in big cities, but in rural areas where there are not enough OB doctors. You can be credentialed to do OB C-sections. That's great, right? There you go, your surgeries. If you have an entrepreneurial spirit and you are graduated in either internal medicine or family practice, you could start your wound care clinic. You can be the doctor that debrides all the wounds, and as part of it's part of within your scope. It's not a big surgery; it's just debridement. You can play with a scalpel there. What else you can do? Procedures you can do: knee injections, biopsies, shoulder injections. You just have to become a little more proficient with ultrasound techniques to identify the spaces. And once you get to be known as doing that, you can be just doing that. If you don't like to deal with diabetes, hypertension, you can just find your niche and just market your practice on that at the end of your residency. And you can also do varicose vein treatments as an internal medicine doctor or family practice. You can take a little course or certification on how to treat varicose veins, and you can remove them, surgically remove them. It's a very simple procedure, so you're allowed to do it, and those doctors get to have a good income by doing that. So those are some ideas. If you want to, if you're having second thoughts on why not to apply to internal medicine or family practice, I think for what I've seen, those doctors have fun doing that because they have certain interest on these areas. and they're learning more about this, and they're good, especially for areas that we don't have that very available. It does come with you putting a little emphasis on those rotations during residency, so you know what you're doing. Maybe getting a certificate, or maybe getting into a little course. There's several courses for this all over the country, and so those are the fun ones. And other side gigs that you can do include being a hospice doctor. You can be hired as a medical director for a hospice company, and you know guide patients on the part that is the end of life. I did that for a while. It was very rewarding to work with families, to work with to walk with patients during that time. It requires a lot of conversations. It requires a lot of being able to provide reassurance to the family members. I like that part. Then you can also be a coach for for other physicians with any special interest that you develop during your career. There are physicians that do talks for schools, for other physicians on how to grow practices. So I guess what I'm saying is, if you have an interest, uh, find out if the residency that you're going to do, like internal medicine or family practice, have something that could lead to that. If you're good at, I don't know, doing knee injection procedures, just focus on learning about ultrasound techniques or sport medicine techniques. If you like the skin, just do well on your derm rotations. If you like, I don't know, pain management, do well on your ortho and pain management rotations. Um, if you have an interest for C-sections, maybe try to impress your OB or gynecologist attendings so they can refer you to those programs that can give you that fellowship. Um, Many things. So I think you shouldn't be very scared of missing out on something, but to know what are the limitations that you have as an IMG. As an IMG, you have certain limitations, and you're already very lucky to match into these primary care specialties. So don't harm your application by applying to three or four spots on residencies that you won't get, because at the end you're just delaying your opportunity to match, and you don't want to do that. So if you have more questions, if you guys have any need for more assistance, just drop a comment down there, and I will come back to you.